The care that a patient gets is not just dependent on how good the doctor is or how much the doctor cares. The care is dependent on the system that the doctor works in.
It's painfully slow to get medical information, new discoveries into practice.
You're so isolated within your institution that it's difficult to figure out what great work is going on and how to move it forward.
ImproveCareNow is bringing doctors, nurses, and staff together to help children with Crohn's disease and ulcerative colitis get better.
We designed a program that had 3 parts. The first was systematically collecting data and sharing it among physicians. The second was sharing knowledge across sites so that information and experience that one site developed wouldn't need to be recreated by another site. And then the third part was providing the technical tools that sites needed to learn how to do this.
We have a database with over 2,000 patients and over 6,000 patient visits. And we have analyzed all of this information in some ways.
There's a monthly report that's actually an interactive database where we can click on a particular category and pull up information on those patients specifically.
When we do pre-visit planning, I'm able to know exactly what we had done in the previous visits, what things may have happened in the interim, and I have certain target items that I need to remember to address at that visit.
Ultimately, the point will be we'll start to plan the care well enough that things won't drop through the cracks. We'll anticipate problems and try to head them off before they happen.
The physicians, we're not asking them to change care, we're giving them an infrastructure to perform in.
Change is always hard. It's slow and steady.
We all see the problem, and we all go back to our sites and try to figure out ways to do it better. And 1 out of the 16 comes up with a huge winner. And now all of a sudden, 16 sites have a great tool that they can use.
We call it to steal shamelessly and to share seamlessly.
I think about the kind of the pre-clinic assessment, which a lot of sites use, which we took from the collaborative and made our own.
Our dietitians are here and they steal forms from other dietitians. Our nurse practitioners are here and they collaborate with nurse practitioners on how the clinic runs and what the medical assistants do.
You don't have to create everything on your own, and you can find that other people have had some really good ideas.
If I give you some good information and I can show you some improvement, why don't we get together and do something that's going to be worthwhile in the end?
And we've been able to raise the percentage of patients that are in an active disease or in remission by 10%.
Without creating a brand new drug, spending millions of dollars on development, it's basically using the resources that we currently have and, in a sense, kind of opening our eyes.
I actually have Crohn's disease myself, and knowing that, these physicians care enough to come together to improve outcomes for kids with IBD, I think it's a great thing.
What's really exciting about this is that it really unleashes the normal motivation that people have to provide the best care that they can.
The real recognition, the real awareness comes from people committing their time and money to projects that raise awareness like this.
If all the kids in the U.S. with Crohn's disease and ulcerative colitis were part of the ImproveCareNow collaborative, 10,000 more would be feeling well instead of being sick today.